Hello, this is my Foley insertion video. To start, I would confirm my facility's policies, procedures, and physician orders. Go over to check the MAR. See that I'm dealing with a Miss Smith, born in 1930, 88-year-old male, drug allergies to morphine. And then I would go from there to gather my supplies, my kit, my gloves, my washcloth. And then I would go over to do my AIDIT and say, hello, my name is Zachary O'Hara, I'm a first year nursing student. Today I'm going to be performing a Foley insertion on you today. So it'll take no more than 15 minutes and we can get started as soon as you verify your name and date of birth for me. I would hand sanitize, ask, okay, I see, you said Miss Smith 1930, alrighty, that's what I have on record. Miss Smith, do you have any allergies to latex or shellfish? She would say no. I'd say okay, well, I'm gonna just shut these shades real quick so we can provide you some privacy. Right. And I'm gonna raise the patient's bed as well to working height. It would raise up. From there I would say, okay, well, I'm gonna ask you a couple other questions. So, can you tell me where you are right now? She would say, I'm at University Hospital, and I'd say, do you know what today's date is? She'd say, like 3/11/2022, and I'd say, all right, when was the last time you urinated? She'd say, I think 6 hours ago. I'd say, all right, I'm gonna check your bladder area just to determine if you still need a catheter, okay? So I pull this back and I would just press down here and feel the distension and say, okay, yep, feels distended, so definitely need to get that catheter on. Do you have any mobility issues that I need to be made aware of? Can you move your hips and legs? Because I'm going to need you to do that so that we, for this Foley and for this catheter insertion. She'd say no. And I would say, all right, well, adjust my mask. What I'm going to do now is I'm going to check the perineal area just to make sure that there's no redness or liquids anywhere. So I'm going to just lean you back, okay? You can raise your legs up a little too. Alrighty, I don't see any redness or any secretions or liquids, so that's good. All right, so now I'm going to move on to the cleaning aspect of things. So I am going to pick up the one towel that's been soaking in soap and water, and now I'm going to initiate cleaning. So I'm going to spread the labia and then go from the side, peel, side, peel, and then down the center. All right, get rid of that in the trash. I'm going to use the second one that's been soaking in water, and I'm going to do the same thing. I'm going to go to the side, peel, side, peel, and then down the center. All right, get rid of that, get rid of my gloves. Alrighty. Alrighty. Put those away. Now I'm gonna hand hygiene. So now I'm going to initiate the process of getting my catheter kit open. So what I'm going to do is I am going to open it up, making sure to open it away from me and not holding it against my body or anything like that. Now this wouldn't be open already, but it's the way it is because it's been used. So I'm gonna put that over here and place this in the trash. I'm gonna set this down. You facing away. All right. I would use this area over here as my trash area. I'm gonna hand sanitize just because I touched some stuff. Alrighty, now what I'm gonna do is I am going to pay attention to the sterile fields, or to the 1-inch border of the sterile field. So I'm gonna pull away, to the side, to the side, and then back. Alrighty, so I'm gonna pull this just a little that way. Now what I'm gonna do is I'm gonna lift up the fenestrated area. I'm gonna lift up the drape, making sure the reflective side is over here. And now I'm going to place it under the patient so the shiny side is down. Alrighty, area is extended. Now what I'm going to do is I am going to pick up my gloves after I hand hygiene. So now going to pick up my gloves here. Alrighty. So I would open this and that. Alrighty, I'm gonna pick this up, pull back, pull in, there we go. I'm gonna scoop these three, making sure to hold my thumb back, and gloves are on. So now what I'm gonna do is I'm going to pick this up and put it here. Alrighty. Now I need to maintain my hands above my waist, but I'm gonna have to lift this up and place this over in the trash area. I'm also gonna place this kit over closer to here. What I would do now is I would then go on to put down the iodine on there. I would move the forceps away, and then I would then put the iodine down, but I can't because it's a mannequin. And then where I go from here is I would put this in the trash. Alrighty, so now I would also begin to I'm going to rotate this there. All right. I'm going to put the lubricant here. Alrighty. Get rid of the lubricant over here. Now I am going to set up my catheter. Making sure to actually, I'm going to uncap this, place this in the trash, and I am now going to connect this this. Just turn it this way. Move this. Throw it on the ground. And place this in the lubricant. So now what I'm going to do is I'm going to start cleaning the perineum area with the forceps. So I'm going to take 1 cotton ball per swipe. I'm going to spread the labia, and I am going to go from, this finger is now glued, or this hand is now glued to this area. So I'm going to go from the side, place this in the trash, go from the side, place this in the trash, go down the center, place this in the trash. Alrighty, now I'm going to throw my forceps there too. Now what I'm going to do is I'm going to initiate the process of insertion. So what I'm going to do is I'm going to continue to lubricate this area up. And now I'm going to tell the patient that I need to, they need to take a deep breath whenever I insert this. So I will tell them on the count of 3 that I will be inserting the catheter. So on 3, 1, 2, 3, take a deep breath. All right, I would insert 2 or 3 inches, and then I would insert another 1 to 2 just to confirm placement in the bladder. Or once I see urine. Once I see urine, I'll insert another 2 inches. So now what I'm going to do is I am going to inflate the bubble. Or the balloon. Making sure not to stand over my sterile field. All right. Now what I'm going to do is let go. Throw this in the trash. And now I can let go and proceed to check the placement of the catheter by pulling. All right, it's placed. I can feel it's not moving anywhere. So now I'm going to remove my gloves. And now I'm going to throw these in the trash area. I'm going to hand sanitize. Hand sanitize. What I would do now is I would place this, I gotta wear gloves first. So, going to grab gloves. It's always the hardest when you gotta have alcohol on your hands, right? Or any form of liquid. All right, now I'm gonna pick this up and I'm going to place it on a non-movable part of the bed. Here, making sure it's below the patient. I'd also attach this to the patient's thigh with tape, but I don't have any here, so that would be attached to the thigh. Then from there, I would go and I would clean up the patient, making sure to clean the area if there's any leakage or anything, and clean the area. So I'm just gonna grab all of these, and I'd throw them in the trash, but I'm going to throw them here for now. Alrighty, now I would then cover the patient up, making sure that they're comfortable, and I would also then go on to documenting the patient's what happened in this experience, how much urinary output occurred, and if any complications happened, and what time in my MAR. But after that, I would thank the patient, and I would and I'd lower them to normal height again and secure them. But after that, thank the patient, document, leave.